I the bad guy?
Am I the bad guy?
Am I the bad guy? Am I the bad guy?
Am I the
Am I the
bad
bad guy?
Am I the bad guy?
I am a relatively new nurse at a mid-sized hospital. I just passed my exams, completed an internship, and got hired on to work overnights. Nurses can't be very picky about shifts when they are first starting out. It can be a very stressful job, but helping people for a living can be very rewarding in itself. I knew going into this line of work that patients are often suffering, both mentally and physically. So I usually have a fair amount of tolerance for the occasional disrespectful or problematic attitude. I was only 12 weeks into the graveyard shift when a very well-dressed gentleman was assigned to my roster of patients. I didn't see him walk in myself, but the admitting nurse said he was wearing a Rolex and a nice suit. They mentioned sarcastically that we had admitted the very delightful Mr. Money for an overnight stay. She thought he worked on Wall Street or was maybe a fancy lawyer. I was actually curious to meet the new patient. I'm an introvert and like listening. Hearing people's unique stories while I'm at work is a personal perk for me and is actually one of my favorite things about nursing. I started evening rounds as per usual. Most of the time it's pretty standard patient care and hospitality on my rotation. For example, a few kids with nasty bumps and bruises, or maybe someone has the flu. Being a tad out of the ordinary, I was sincerely looking forward to hearing Mr. Money's rich guy stories. I walked into Mr. Money's room, and before I could introduce myself and examine his chart, this guy just started raising his voice immediately. My brothers used to tease me a lot growing up, so I have tough skin. I thought at first maybe he was joking. He wasn't. He was ranting about how he had been waiting for a second pillow for an hour and how ridiculous the staff at the hospital were. I waited for him to finish and held back my urge to explain I had just gotten into work. Sometimes patients are having a bad time at home or at work and carry that stress into the hospital. It's not easy, but a kind response can make the difference between good or lousy patient care. Plus, we get ratings at our hospital that affect our bonuses, so it pays to be nice even if a patient is a bit grumpy. Mr. Money was the exception to the rule. I was about to introduce myself after the pillow rant was over. Nurses can get very busy with other patients on the roster who have high priority needs, and we were nearly full, so grabbing a pillow can sometimes be a low priority, especially when another patient is being monitored for a heart condition that could get set off at any time. I started to apologize to Mr. Money, but he interrupted me and called me lazy. I think maybe he had confused me with the nurse who was in his room earlier. I paused and took a deep breath. With a smile on my face, I very calmly explained that I was only just getting onto the floor and would look for the pillow for him. Mind you, he already had 3 pillows, but sometimes patients do legitimately need them for their knees or backs. He said thank you with a practiced, searing smile that could peel the paint off a wall. I left the room thinking that his blood sugar must be low or something. It's not uncommon. I can get hangry when I haven't eaten too and have had to apologize for saying something I didn't mean. My ex-boyfriend used to make me carry gummy bears or mini pretzel snacks around in my purse for just such emergencies. I left the room and asked the shift leader why a pillow hadn't been sent over to Mr. Money's room. She started laughing, which was confusing. She said that he had asked for a pillow less than 15 minutes ago, and we told him that the fresh laundry was on its way upstairs and would be with him as soon as it arrived. I try to be a very empathetic person, even in challenging circumstances, but I legitimately hate liars. I went back to the room to, again, attempt to introduce myself and let him know a fresh pillow was on its way as soon as the laundry arrived on our floor. On the way back, I assisted another patient who was coughing badly and changed an IV bag for another patient. All standard practice in a hospital where patients with legitimate issues need to take priority. Shortly after checking in with my other patients, the squeaky wheels of the laundry cart started meandering down the hallway from the elevator. I figured I could start over with Mr. Money and try to start fresh. so I grabbed a pillow and headed down to his room. As I stepped into the room with the all-important pillow, he said, "Finally, and it's about time," without even making eye contact. What was this guy's issue? I handed him the pillow, and before I could say a word, he practically snatched it out of my hand. I calmly introduced myself. He said, "Thanks for the pillow," but it was laced with sarcasm. I introduced myself and explained I was assigned to him for the evening and would be happy to assist him if he needed anything. He just said, "Okay, great," and handed me his dinner order. I knew it. He was definitely hangry. His chart said he was experiencing a severe migraine, low blood sugar, and was experiencing muscle pain in his legs, possibly for being on his feet too much as a traveling auditor who needs to walk long distances at government facilities. The doctor had ordered him to take it easy, up his hydration, avoid stress, and not leave his bed for the night to keep any tension or stress off his legs. It was probably just dehydration, but he had really good insurance. It couldn't hurt to do a scan and some muscle relaxant. He wanted to take advantage of his premium medical insurance and get the pain meds because he had a business meeting the following afternoon and didn't trust the cheap over-the-counter stuff. The rest of the floor had already put their dinner requests in, and food was being sent to rooms already. He had waited to put his order in for so long that other rooms were already getting their dinners, but he still wouldn't have to wait very long. Maybe an extra 10 to 20 minutes. I remember his order well. A cheeseburger, macaroni salad, Jell-O, chips, and chocolate milk. He underlined no pickles and put 2 large exclamation points in the special request section. I personally really like pickles, but everyone has their preference. I was adjusting a patient's oxygen in the next room when I heard the call for assistance button alert going off in his room next to mine. The head nurse saw I was busy, so she headed over to check on him. I heard a loud metallic bang and then whoops from Mr. Money. The head nurse left the room steaming. Her scrubs had something wet on them and I already guessed what happened. She was visibly upset but holding it together and went to go change her bottom scrubs. This wasn't the first time she had gotten a pair of scrubs soiled, but Mr. Money's bedpan accident really triggered her, and when she returned, she was visibly ruffled. I was furious. No one disrespects the head nurse. All the nurses at the hospital respect her, and she is one of the best mentors anyone could ask for. We put up with a lot, but pretty much all the nursing staff draw a hard line if we see someone disrespecting her. That's when I heard Mr. Money audibly complaining when he spotted the food cart in the hallway about not getting his dinner yet. He placed his order last. Wow. I froze when I noticed it. The kitchen's food delivery server had mistakenly swapped a standard chocolate milk on the dinner order with a chocolate laxative beverage meant for another room. I think they were nervous or confused when Mr. Money began berating them and hurried to bring in the food tray. The nervous kitchen staff headed straight for Mr. Money. Our nursing staff are trained to pay close attention to things like patients' diets and often keep an extra eye out for kitchen deliveries, especially for those with food allergies. Apart from the rather explosive chocolate beverage, the dinner Mr. Money ordered was nearly identical to this food tray, so it was an easy mix-up. I'd actually started to walk to his room to correct the error. Even a nasty patient should be treated with respect. Just because I don't like someone personally, I am committed to doing no harm and take that very seriously. As I was just about to enter the room to take the tray away and let Mr. Money know his food was still arriving from the kitchen, with the last food deliveries of the evening, I saw him toss something on the floor from the dinner tray. He had gotten pickles on his cheeseburger. Remember, this wasn't even his dinner. He threw the pickles directly onto the floor and let out a disdainful typical with an audible grunt. I don't know what came over me, but instead of taking his tray, I grabbed a napkin, calmly picked up the pickles off the floor, tossed them into the waste bin, smiled politely, and then left without saying a word. Maybe I should have said something, but between him accidentally, yeah right, getting pee on my colleague, and the way he was disrespecting all the staff members, I didn't feel the need to correct the mix-up. I mean, the chocolate laxative was labeled, so it was kind of on Mr. Money if he wasn't paying attention. I'm pretty sure he downed the entire bottle. As a side note, I did make sure the other patient received the laxative their doctor ordered for them. I hope Mr. Money's meeting went well the following day. I imagine he must have had the embarrassment of running to the little boy's room more than once during the presentation. Luckily, we never received a bad rating. I usually have more restraint. However, in this case, I couldn't help but let nature take its course. Am I the bad guy?
If you enjoyed this video, please click the subscribe button, then click again and hit the all bell notification option, so you'll be the first to know when the next bad guy story is available. Remember to hit the like button, share with a friend, and drop your comment and thoughts below. Do you have a bad guy story that you would like to share? Send your story to badguystories@gmail.com. Thank you for being part of our community, and have a great day.